Today I would like to talk to you about 59-year-old gentleman who had pain in his left foot for last many years, and finally when he came to see me, we diagnosed him with early arthritis of the grade 2. Now there are various modalities of treatment for them, which includes painkillers, anti-inflammatories, shoe modification. Now he had undergone all this beforehand, before he saw me, and the only option left was do surgery in terms of taking the extra bone off on the top of the grade 2, which is called as a cheilectomy, or have a fusion surgery where we fuse the two ends of the joint. Now his joint was not that bad or damaged that he needed a fusion, so we honed on that probably the best option for him would be taking that extra piece of bone called as cheilectomy. Now traditionally we do an open incision of around 2 inches on the top of the grade 2 joint and remove this extra piece of bone, which is a very good surgical outcome. But then you have an incision, you have a soft tissue dissection exposure, which has its own limitations in terms of recovery time, pain, bleeding and small chance of infection. So today, for the first time in India, we have done a cheilectomy through a minimally invasive surgery through just 2 small keyholes less than a centimeter. So that is called as a MIS Cheilectomy, was done first in India through special instrumentation which is available at Nexus Centre in Mumbai. Also, for the first time in India, we did something called as a arthroscopy or a keyhole surgery of the grade 2 through a 1.9 mm, which is a very small instrumentation, 1.9 mm nanoscope, again available in Nexus Centre, provided by Arthrex company. So this was also done to assess the damage to the joint, and I'm glad to say that the joint was not that bad that he needed a fusion. So the patient is also very happy, and I think he will get a good result out of this surgical option. And also at the same time, when we looked inside the joint through the nanoscope, we found that there was a lot of bone debris which we could easily remove it, but otherwise the outcome of the surgery gets affected. So we did an MIS cheilectomy and a nanoscope, using a nanoscope did a arthroscopy of the grade 2 joint. Glad to say that everything went very well. He has got fantastic movement after the surgery, and this was all possible because of all the instrumentation available at Nexus Centre in Mumbai, and all provided by Arthrex.